Hi everyone. Today we have a really important announcement to make. I'm delighted to be able to confirm NHS Grampian is now the first of Scotland's regional health boards to become an actively anti-racist organisation. In addition, we're also launching a year-long awareness raising and training campaign designed to turn that commitment into real and tangible change. But what does being anti-racist mean exactly? We've had a strict zero tolerance policy against racism for years, and we're sticking to that. But today's move is an even bigger and necessary step forward. Being actively anti-racist means more than just saying we won't tolerate it. It's about actively challenging racism and discrimination wherever we come across it. It's about acknowledging our own biases and working to overcome them. You see, over the last few years, we've learned a lot more about just how much damage racism can cause. Setting aside, just for a moment, the very real moral and ethical issues, racism affects mental and physical health of our colleagues. Racism leads to more stress, more anxiety, and depression. It makes it hard for people to focus on their jobs and provide the top-notch care to patients that they normally do. So, what are we going to do? For a start, we're going to be making sure colleagues can access additional training in unconscious bias and also in active bystandership. That means we all will have the skills to step in where we witness racism or discrimination. We all also need to be ready for tough conversations about race and racism when we stand up for our colleagues. And we need to be willing to listen and learn from others' experiences. Now, believe me, I get it. Talking about racism openly can be intimidating. When Snay first contacted me through his work with our Staff Equality Network and also our GEMS group, I was nervous. I'm a white, middle-aged guy. I didn't want to put my foot in it, to say the wrong thing. I wanted to be supportive. But I've learned loads, and it's been eye-opening. It's clearer than ever to me that discussing race and culture in a friendly, a curious way can actually bring people much closer together. And I've also learned, and this is really important, racism isn't just an issue for ethnic minorities to tackle. It's on all of us, especially those of us in privileged positions. We need to step up, call out racism when we see it, and support our colleagues who experience it. The onus is on us, all of us, to be allies for our colleagues rather than passive. This plan, now in effect for NHS Grampian, calls on each of us to be anti-racist. That means you personally, figuring out where in your service, in your team, and even within yourselves, we can make a positive change. It isn't a job for a single team or a department. It's a commitment we all must make. Now, we're not saying NHS Grampian is a hotbed of racism, but every organisation has these challenges. And we're here to do the right thing for our colleagues by facing those difficulties absolutely head on. I know some people will be worrying away and thinking we're going to be labelled as woke or overly politically correct. But let's be clear, this is about treating our colleagues with respect and with kindness, and all of us standing up for them. We all must stand shoulder to shoulder with our colleagues. It's a big ask, but I truly believe we can and we must do it. We have an incredible team here in NHS Grampian, and with a little effort from each of us, we can become an anti-racism organisation. To close, I'm asking all of you to be part of this work, as together, I know we can create a more just, a more equal, and a more effective NHS Grampian for absolutely everyone.